Welcome to our 5 on 5. Pleased to be joined today by Health Officer for Jackson County, Dr. Jim Shames. Good to see you, sir. Thanks for coming.
Good to see you, too. Thank you.
So, a couple weeks ago, Jackson County sent out a red alert regarding opioids. I believe there was 2 weeks of that. Yesterday, sent out a yellow alert, so things are improving.
Correct.
Okay, so what exactly brought this whole thing on, these red alerts and yellow alerts?
Sure. So, if you go back to the spring of 2018, we had a cluster of fatal overdoses that took us by surprise. And we realized that, first of all, we didn't have a mechanism in place where we could identify in real time when people were in trouble with drugs. And we didn't really fully have a system whereby we could mitigate, reduce the amount of injury that could result from that. So since that time, we've had meetings with all our key partners, emergency medical services, emergency departments, law enforcement, to get a strategy together whereby we could get feedback on a weekly basis or a daily basis if need be, so we could identify when there was a problem. So fortunately that cluster, although it was quite significant, eventually went back to sort of a baseline. And we've been measuring week by week what that baseline looks like. How many transports for overdoses, how many fatal overdoses, who shows up in the emergency department, how many times naloxone is given by law enforcement, that sort of thing. Mm-hmm. And then on the 20th of December, we had a spike in transports, overdoses. There was a fatal overdose in that. And it was such a significant difference from the baseline that we issued a red alert. And we saw continued activity much above normal for about for those 2 weeks. And then things quieted down a bit with less activity, but still above baseline. So that's the principle upon which we're using the red alerts and the yellow alerts.
Okay, and so this is, correct me if I'm wrong, this is heroin. I know we're talking about it's opioids, but is this the fatal overdose, or what we're seeing, is this all tied to heroin?
Well, that's a good point, and sometimes we don't know. Just because somebody injects something they think is heroin doesn't mean that it is heroin. There's fentanyl that's adulterated a lot of the heroin supply. So that's part of what this is about, is to recognize when perhaps either a strong batch of heroin is in town or fentanyl has been added to the heroin and people didn't know it. So we can try and get the word out, and folks can do as much as they can to stay safe.
Fascinating. All right, we're going to take a quick commercial break. Much more in just a moment. Stay with us. Welcome back to our 5 on 5. We're going to hear with Dr. Jim Shames, a health officer with Jackson County Health Department. So we're talking about the red alerts. We had two weeks of red alerts regarding opioids in Jackson County. This week, a yellow alert, so things are improving. You said we've had one fatal overdose. How many non-fatal overdoses have we had?
So during that 2 weeks of the red alert, normally you'd expect about 2 emergency department visits a week for overdoses. We had 18. We had, I believe it was 11 episodes of naloxone being administered by law enforcement during that time, and 13 transports by Mercy flights for overdoses. We have no idea how many people used naloxone who had it on hand and never called 911. This is sort of the tip of the iceberg, but clearly these are numbers that are above our background information, so that's why we acted.
Yeah, and it's interesting, you talked about you're working with the hospitals, you're working with police agencies, you're working with even the medical transport agencies. Right. How do we know, or do we know, can we know what is doing this? Is it, like you mentioned, fentanyl? How do we know if that's what is the quote-unquote problem?
Right.
I guess.
So it looks like the problem is a so-called strong batch of heroin in the community. This is primarily heroin we're talking about. Within that, it could just be, a new supplier, stronger black tar heroin. It could also be adulterated heroin with fentanyl. We do have people who use test strips to test their drugs, and we get feedback from our syringe exchange program about that. We eventually get information back from the state laboratory. That there's quite a lag time in that. At the moment, we don't have information to suggest that all of the heroin in town is adulterated with fentanyl. It almost doesn't really matter. in the sense that clearly what people are using is stronger than what they were expecting, and they need to take precautions either way, whether it's fentanyl or just more a stronger batch of heroin.
Yeah, and in case any of those people are watching, obviously we want them to be as safe as they can be. What should they be doing?
Okay. First of all, the safest thing to do, of course, is get treatment. Medication-assisted treatment is very effective for opiate use disorder. There's lots of opportunities in this community. You can call Stay Safe Oregon to find out what your options are. Not using alone, using a test dose to see if it's the same potency. And just for loved ones to be aware that people they know who may be using may be at higher risk. Carry naloxone, it's a life-saving drug. I think those are the basics, and there is treatment that is quite effective, and our community has done an excellent job in making that available. So, ask your provider, ask someone who can help set you up.
Yeah, and don't be afraid to call 911. And Good Samaritan law.
Thank you for mentioning that. That's right. Call 911. No one wants to get you in trouble. They just want to save lives.
Absolutely. Thank you so much for being here. Appreciate it.
Good to see you.
Stay with us. We'll be right back.